Cancer and its treatments come with a cost, and there are many things that can happen to people either permanently or with a later onset as a result of that treatment. And it's really important that as healthcare professionals we understand what these could be and actually what we can do about them. And really we need to work in partnership with people that have been affected by cancer to make sure that they understand what can happen to them and they know where to go to seek help. And as professionals we really address this from the beginning and acknowledge that actually that you can't treat someone for cancer without possibly having some consequences. As time goes on, when more and more people are living with and beyond their cancer diagnosis, we will start to see more and more complex needs for these people. And actually it's important that the workforce not only understands cancer and cancer treatment, but also understands the consequences and is able to provide the complex care that people require. And it's really important to acknowledge that that will not always be in hospitals, that is predominantly within primary care.
The model now is that we have so many more survivors. It's a really good news story. We're talking about 70% of patients surviving cancer. But with the toxic therapies and combinations of treatments, these patients often have problems or needs that may go unmet. So it's about promoting health, it's about preventing risk, but it's also about providing the right support at the right time.
Increasingly patients are developing long-term and late consequences of treatment, and there's a growing evidence base to demonstrate that our cancer survivors are suffering physical and psychological problems long after their cancer treatment.
We really hope that the 10 top tips in the Healthcare Professionals Guide will help both patients and professionals to plan care and support self-management so that the long-term consequences of cancer treatment are properly assessed and managed, and that people have the confidence and the tools that they need to live well after a cancer diagnosis.